I'm going to move on to the next session, which is titled Return to Nursing. There's been a lot of work during COVID around this. I'm going to hand over to my colleague Vince Baxter, who's also going to be talking to Kate Pound, Richard Brownhill, and Paul Reeves, who's the head of nursing for NHS England and NHS Improvement. So, Vince, are you there?
Hi, thanks, Pete.
Over to you.
Thanks. So, one of the ways that the NHS responded to COVID-19 was to initiate a programme called Bring Back Nursing. And another element to the programme was also bringing healthcare support workers into the NHS. And I'm really pleased this morning to be joined by three colleagues, as Pete's just said, to talk about those two elements of the programme. So I'm going to start by talking to Paul Reeves, who is Head of Nursing, Education and New Roles at NHS England and NHS Improvement. So just going to begin with, Paul, could you just describe very briefly what the healthcare support worker programme entailed?
Yes, thank you very much for that. We started to bring back healthcare support workers back into the NHS. It was part of a programme of work that we were doing to try and bring staff back into the NHS, and it followed on from bringing back registered nurses, registered therapists even, and other registered professionals. So we started the healthcare support worker programme in May, and initially we started to look at bringing back people who had left the NHS within 3 years. But very quickly we realised that we would also, though, within this programme, though, have nurses who weren't eligible to be put back on the temporary register, nurses who had qualified elsewhere in other countries. And so we very quickly started to expand the programme to look at bringing people in who could fill healthcare support worker roles. And in so doing, then, what we did was to develop interview templates for people, so that when we were interviewing people to see their eligibility to come back into the NHS, we had a structured format of questions for people to ask. So, and then if people then were successful through that interview process, we then passed them on to our HR teams who did all the security checks and so on and so forth. So it was a big program to bring back healthcare support workers or people who could fulfill healthcare support worker roles.
And what were the key things that really enabled the programme to be delivered, Paul?
I think for me, one of the key things was bringing a team of people together to do those interviews. And that team was people right the way across the whole of NHS England and NHS Improvement. But also, though, we co-opted people in from the CQC who were essentially not doing much because they weren't doing their inspections. And we brought this eclectic team together of people with significant healthcare experience or who were clinicians, and were able to go through the templates and the information that we provided to bring people back into it. But for me, I think also was the daily huddles that we had to bring this team together. And also the PDSA cycles we did every day. How was that for you? Is this template working? What were the stories that you were hearing? And sharing stories and learning from each other. And I think that was absolutely key, so that we could continue the PDSA cycles every day and everybody could learn. And of course, the ESIS team were very much supporting us with that and helping us to develop that shared learning experience.
So I'll go to one of my other ESIS colleagues, Kate Pound. So Kate was, and I was as well, one of the many participants from across NHS England and NHS Improvement that supported both the programmes, and we heard many stories speaking to people who wished to return to both healthcare support worker roles and to nursing roles. So Kate's going to share some of those stories with us now. So over to you, Kate.
Hello everyone, thank you very much for the time today to share these stories. So I mean, I was really touched to be involved in this work. I mean, what was clear to me was the compassion and the energy from people to really, you know, they wanted to be there at the front line no matter what the risk was, to support our staff with caring for those with COVID or caring for anybody that was in need. And some of the stories that really resonated with me was, I remember speaking to one person, and you know, his reason why he wanted to get involved was, you know, his sister had died. And what better thing could he do than to roll his sleeves up and get involved? And that really touched me, the compassion and the empathy that came from these people. And, you know, the other thing that was really important was their experience and their skills. So there was one person that really stands out with me. She was quite a young person, you know, in her early 20s. And she had such a breadth of experience. You know, she'd been working in the community, looking after patients on ventilators, which were being cared for at home, and the breadth of her experience and her knowledge. But yet, the famous line we kept on hearing from people was, it was really hard to get to work in the NHS. So those were some of the messages, and you know, that we've just talked about our feedback and feedback loop. But it was just phenomenal. These people were there with great skills and wanted to come and help. And then I was going to say the third group that really blew my mind away was the cabin crew. And I know when I first heard about, you know, we're going to be looking at cabin crew, I was kind of like, really? How cabin, you know, what is the transferable skills? But then when I actually started to learn about the fact that this group of staff have advanced skills in, you know, they can deliver a baby and deal with all sorts of medical emergencies. And then when I started interviewing the cabin crew, oh my goodness, they were just amazing. And they were going through such a difficult time for themselves. You know, they were told you can't work. You know, there was risks of redundancy. You know, they were going through really difficult times. And to be able to help them see a future, and that future was in the NHS, in our family, was absolutely amazing. And, you know, some of the stories they told me, and, you know, I think about what, as a nurse, I've had to deal with on the wards, but their stories were like, you know, dealing with cardiac arrest mid-air, and then having to do CPR as planes are coming into land, or having to deal with a death in flight. And you've got the family, you've got distressed passengers, you've got all sorts of things going on around you. And it soon became evident that this was a group of staff that certainly had skills that could support the NHS and become part of our family.
That's great. Thanks, Kate. Are we able to go over back to Richard now?
Some of the things that Richard may have been talking about was how some of the how the program developed over time, and you know, sometimes you building the airplane as you go along. Do you want to just touch on that a little bit?
Yeah, so as I mentioned, I was one of the ESIS staff, just a small group of the wider group of staff from across NHS EI that responded to the call around this. And one of the things about this was it was an improvement journey. I think Paul touched on it, and you've just mentioned that, Nick. We were building the aircraft as we went along, and we did learn a lot. The daily huddles, we had huddles for the nursing element, just the same as they did for the healthcare support worker element. And actually, and I can't remember at what point in the program it was, but we actually joined the two daily huddles together. We tested things, so there were lots of tests of change going on, and we had a kind of quite a structure in terms of the way we sort of huddled every day, so we could pick up the learning. So you know, the nursing element was an improvement journey, just as the healthcare support worker element was.
Yeah, great. Well, I know we've spoken before about this, and some of the really interesting word that you picked up on, and just as Kate mentioned, the amount of people who wanted to come back, either to yourself or to Paul. What were the kind of numbers that you saw in the end of both nursing and healthcare support workers that you saw coming forward, but also actually managed to get into nursing?
I'll let Paul pick the health. I don't know the numbers off the top of my head, but Paul might have an idea. And
I was going to say, I think also at this point as well, Nick, it would be important to add in that for many this was only their start of their journey, and being in touch with us meant that it supported other improvement work, and actually many of the ESIS team members actually became almost kind of like did career coaching with our people that we're being in touch with about how to get into the NHS, and what, you know, many of them are interested in becoming nurses. So and I think those are, you know, really important aspects that perhaps weren't necessarily anticipated at the beginning, but actually grew. I'm sure Vince would agree with me on that, and Paul.
That sounds like a really important point, isn't it? Where, you know, this was a route for people to come in as well if they had any kind of interest. But I think, as you touched on, there were people that just, and I maybe touched on before, there was like a call to arms, wasn't there? There was a point where people felt, you know, if we thought about it before, this was the point where I'm going to do something about it. Is that something that?
Yeah.
Oh, Richard's back. Hi, Richard.
Hi, everybody. My apologies. Technology has befuddled me there, but I think I came in at an opportune moment talking about some of the numbers and some of the challenges. So, I mean, I think, so this began back on the 20th of March, and you may remember the NMC wrote out to a number of retired registrants and said, if you retired in the last 3 years, did you want to consider coming back as part of our COVID response? And it's fair to say the response was overwhelming, and I think that's both in terms of people's interest to come back and do that work, as well as people's interest, if you like, within teams to try and help make that happen. So there are 11,740 registrants that took the call to arms, which is a big number. And I guess if you spread that over the last 6 months, that may not seem quite as challenging. When you consider that 5,700 applicants applied within a week of that call to arms, there was an incredibly small 3 or 4 person team who was trying to do something called the Return to Nursing programme at the time. And I think that just gives a sense of scale around really the challenge and the positive benefit of all those people responding. I think that led to trying to very quickly mobilise an infrastructure that would manage that volume of people. And one of the things we learned very quickly was building as you go, trying to learn as quick as we can. And I know others have mentioned working together to kind of provide that very rapid feedback loop to learn and be doing things better the next day. I think one of the things we would recognise is that if we did that again, we've got a tried and tested method. We know, broadly speaking, how long things take to do. We know what kind of resource we need behind it. So we've learned about how to set up something at that scale and magnitude. I guess we maybe didn't expect that volume of people in such a short period of time. And you may remember Ruth May, the chief nurse, on BBC News. And you can see very clearly, like you often can in an SPC chart, that correlation between that public call to arms and then the immediate volume of people received both in our email inbox and on our survey responses. So I think it's fair to say that, you know, it was an overwhelming response. But lots of positives in terms of people working together to create a solution. And most of the team acknowledge, and I know Kate talked about some of the personal stories, none of us, I think, can underestimate some of the sacrifices people wanted to make to come back and be useful and do things, as well as conversations we had with people who weren't able to come back but wanted to help, and experience frustration. So this process, I think, didn't respond at times as quickly as we might have liked. And you may remember that, I suppose, when we set it up, we were thinking that there was going to be an enormous requirement for all those nurses. And in some respects, it's positive nationally that didn't happen. But I sense there are frustrations from people that pulled out all the stops to want to be back and doing things that may not have realised their ultimate goal. Partly because that's where we got to. the good bit now, I suppose, is we're left with a really positive story about nurses and people wanting to come back. And we've seen an improvement and an increase in the number of people that want to undertake return to practice OSCEs. So it was a very good marketing exercise in terms of being able to get people back into the profession. I think the other things we've learned, and is built on the National Recruitment Retention Programme learning, is that flexibility was really key. And lots of organisations began to offer flexibility to people, and the people we spoke to often had left the profession because of a lack of flexibility. So I think we need to hold on to things like that and really use those to try and help us to become more responsive and agile as we go forward, whether it's in or out of COVID.
Thanks, Richard. I think that's a sort of good lead in. I'm going to give the final word of the session to Paul. So Richard's just talked about how the programme from the nursing perspective has shaped some of the thinking.
I don't know if Vince is coming back in.
So can you hear me?
Can I answer Tim's question? Because Tim's posted a question about, do we think it will have a positive effect? So I think I mentioned a couple of things about recruitment retention. It was certainly the biggest marketing campaign that we've ever seen. And when we've looked at the shortfalls in nurse staffing and a number of active campaigns, this had a significantly stronger effect as a national call to arms. But I think if you think about the type of people that work in healthcare, they're often people that want to be very giving of themselves and trying to put themselves forward to continue the good work and living those values that they've got.
Okay. Can you hear me? Not sure. If
yes,
you can hear me. Oh, right. Okay. So Richard's just spoken there about the impact of the programme on shaping the future of nurse recruitment. So I'm going to give the final word here now, the last few minutes of our session, over to Paul to talk about how the experience has shaped the recruitment of healthcare support workers. So back to you, Paul.
Thank you very much, Vince. Okay, yeah, so what we're doing now is we've now got a major recruitment programme going for healthcare support workers, and that's healthcare support workers in every sector: mental health, acute, maternity, community, learning disabilities. We're aiming to recruit 20,000 healthcare support workers and looking at all the different avenues we can get into. So we are considering cabin crew, we are considering people going into schools and sort of educating people around how school leavers around how to come into the NHS. We've also looked at the care certificate and developed a fast track care certificate. So those that have got lots of experience in different sectors can undertake the care certificate and progress through that very quickly. We're looking at people who also have got degrees in other subjects, geography, history, whatever, and giving them healthcare support worker experience, putting them on the getting them to do the care certificate, and then fast tracking them through to getting them fast tracked through to RN training. So the program really has, the initial returners program has really helped us to shape this big recruitment drive for healthcare support workers and looking at different avenues for people to come back to come into the NHS and have it as a career for life. The other thing I think is also important, and Richard did touch upon this, and that is that those that are on the temporary register currently, we are having a big drive to encourage them to do the test of competency or the return to practice courses, so that they then can go back and rejoin the permanent register. So both the RN returners program that we did and also the healthcare support workers program we did has really helped us to shape these new programs to bring new people into the NHS and also encourage those that have got experience to come back into the NHS, but also do it in a very structured way, a supportive way, so that people who do come into the NHS the very first time, they've got a clear career pathway. Thank you very much.
Thank you, Paul. And thank you to Richard and Kate as well. And as you've heard there, I think the both elements of the programme, as Paul has just said, not only responded to the initial call to arms, but have helped start to shape some of the thinking in terms of the future of recruitment for both healthcare support workers and nurses. So I think I'm passing back to Pete now.